Association of Rhode Island. I'd like to call us Mahari. Thanks for being here today. Your presence tells our leaders that mental health is just as important as physical health, and it needs to be a priority even in the face of potential federal funding cuts. It's really inspirational to see so many people here today. Thank you so much for coming. First, I want to acknowledge and thank our elected officials who are here today. I see Chairwoman Susan Donovan, and I have some RSVPs from Senator Robert Brito, Senator Hannah Gallo, Senator Lori Urso, Representative Marianne Shellcross Smith, who will be here shortly, Senator Jessica De La Cruz, and Lieutenant Governor Sabina Matos. Welcome. And we are so lucky because we have so many friends in this State House. All the way from the Governor's Office to the General Assembly, we feel welcome and we feel supported, and we're really lucky. I'd also like to acknowledge Cassandra Flores from Senator Jack Reed's office, who is here with us today on the Senator's behalf. And I'd also like to acknowledge Kate Mashad from Representative Ambo's office, who is here on behalf of the representative. I am so grateful for our congressional delegation. They care about mental health genuinely, and they are fierce and unstoppable. So impressive. We are so lucky to have them in Washington, D.C. I'd also like to thank all of our state departments and agencies who collaborate with the Mental Health Association and do such great work in the community. Your public service keeps Rhode Islanders healthy and safe and makes Rhode Island a great place to call home. I'd also like to give a special thanks to the Rhode Island Department of Behavioral Health, Developmental Disabilities, and Hospitals. Thank you for your compassion and advocacy, and for helping to build a stronger and more inclusive system of care. Mahari rarely goes it alone. We often work in coalitions. We bring stakeholders together and work together on common causes. So I want to say thank you right now to all the advocates from the extraordinary community organizations who partner with us day in and day out. Your partnership and dedication to this work make possible any victories that we've achieved over the years. And because of these passionate, dedicated community organizations, the behavioral health community has become a constituency of consequence in this State House. Finally, I would like to thank our elected officials whose support makes this whole system of care possible. Thank you, Governor Daniel McKee, Lieutenant Governor Sabina Matos. Thank you, Speaker Joseph Shekarchi, and late President Senator Ruggiero. Also, thank you to our whole General Assembly on both sides of the aisle, because mental health affects everyone. Thank you for investing in our system of care and passing laws that increase access to services for those who live with mental illness and substance use disorders. Thank you for caring about Rhode Islanders. Here are just a few accomplishments from the past year. Last year, the fiscal year 2025 budget included over $163 million to fund Medicaid reimbursement rate increases for behavioral health services and children's services. It was no small feat to make that happen, and I'm so proud of the community organizations who led on that effort. It was one of the most important victories we've had in a long time. The budget also included over $76 million to support the establishment of certified community behavioral health clinics. And these special clinics take everyone who walks through their doors, regardless regardless of their ability to pay or the type of insurance they have. It included over $2 million to provide law enforcement and crisis intervention training. It included over $4 million to be paid over a number of years to support the 988 Suicide Prevention and Crisis Line here in Rhode Island. And it increased by $17 million funding for housing stabilization and services for unhoused Rhode Islanders. Our leaders also passed legislation to update social worker licensing requirements and created the Mental Health Counselors Compact. These will both expand access to services in Rhode Island. Let's give Governor McKee, Lieutenant Governor Mato, Speaker Shikarchi, President Ruggiero, and our whole General Assembly a round of applause just to show our thanks. We've made many important gains over the past few years, but of course, there's so much more to do. Today, we're calling on our leaders to continually invest in our behavioral health care system because we need a complete and robust continuum of care. Gaps in the continuum of care translate into Rhode Islanders being over-institutionalized in hospitals. They don't necessarily need to be there, but we don't have a lower level of care that would meet their needs. Also, when we have gaps in our system, people who reach out for help, people who might be struggling and might finally courageously take that first step of reaching out for help will be met with a wait list. And I can think of nothing more demoralizing than asking for help and being placed on the wait list. We continue to see wait lists, especially for the child and adolescent behavioral health services. Wait lists are unacceptable because waiting can cost someone their life. I can attest to this. Behavioral health services saved my life twice. I was diagnosed with anorexia nervosa when I was 17 years old. I was disappearing a little each day, lost significant weight. Lucky for me, I was able to get all the help that I needed through my mom's health insurance company. I was given 4 weeks of residential treatment, 4 weeks of partial hospitalization, and 15 weeks of outpatient therapy until I left for college. And all of those levels of care were important to my recovery because the residential treatment got me stable, it got me eating again, and the partial hospitalization helped me transition back into my life in a more slow and controlled way and taught me a lot of coping skills. So all of those levels of care are necessary for recovery. The second time it saved my life, I've lived with depression probably my whole life since I was a kid, but in my late 30s, I had a very severe episode of clinical depression. I was very depressed for 18 months. Antidepressants didn't help and therapy didn't help. I was really struggling. I would cry at night every night when I got in bed. I would cry in the bathroom at my office. I cried once on the subway in Boston. On my 40th birthday, I tried to take my own life, but I survived because I was given a psychiatric bed in a hospital, and I was given that bed for as long as I needed it. And I'll say it again, behavioral health care saves lives. We need to end wait lists. The state has a role to play in this, but so do private insurance companies. Today, we're also calling on our leaders to allocate a sustainable funding source for our 988 Suicide Prevention and Crisis Line. Yes. 988 saves lives every day. Since its launch in 2022, Rhode Island's 988 and BH Link have answered over 65,000 calls. That's 65,000 lives that they've touched. We have one of the highest call answer rates in the country, and we need to support 988. We also need our leaders to continually fund certified community behavioral health clinics, youth mental health services, support supportive housing for Rhode Islanders with disabilities. No one should be homeless because they have a disability and lack supportive housing. It's also critically important that our leaders preserve and protect Medicaid. I know that we are expecting a budget deficit, and I get that the federal administration will likely cut Medicaid. And I understand that when faced with budget cuts, leaders have to make really tough decisions. Practical leaders will examine their priorities and analyze the costs and benefits of each item in their budget. Wise leaders, however, also take into account the long-term consequences of their decisions and the human toll. Today we stand at a critical juncture. Do we as a state cut funding for Medicaid and our behavioral health care system and leave vulnerable Rhode Islanders to struggle on their own? Do we let them go without treatment and services, even if it costs them everything? I say no, because mental illness doesn't disappear because we have a budget shortfall. We must show up for these Rhode Islanders. It is our moral duty to take care of one another, especially the most vulnerable among us. Rhode Islanders need timely access to care, and we need our leaders to continually invest in our system of care. And I'll say it again, behavioral health care saves lives. We as individuals also need to show up for one another, to support one another, to create loving and accepting communities where people are not judged or shamed for mental illnesses, including substance use disorders. We all know someone who lives with depression, or a bipolar condition, or alcohol use disorder. 1 in 5 adults in this country will have a mental illness in their lifetime. Maybe some of you who are here today are struggling right now. Maybe you wake up each day and fight a battle and to keep moving forward, to not lose hope, to keep going, and not to go back to that dark place. No one should suffer alone. Healing does not happen in isolation. Healing happens in loving families and communities. We need to show up for one another. Today we will present awards to 4 leaders in Rhode Island who have shown up for us time and again. Their public service has created lasting changes in Rhode Island. We will also hear from 4 courageous speakers who will share their personal stories and inspire hope and compassion. And now please welcome the Director of the Department of Behavioral Health, Developmental Disabilities and Hospitals, Richard Leclerc.
Good afternoon, everyone. And thank you, Lord Marie and the Health Association of Rhode Island for once again hosting this event. It's my pleasure to join you for what we consider the formal kickoff of May's Mental Health Month. And before I get into my remarks, I'd like to acknowledge the leadership and support we've had from Speaker Shikarchi, who's here with us, and for all Senate Minority Leader Dela Cruz, who is also very supportive of all things mental health and behavioral health care in the state of Rhode Island. As we mark this important month, I'd like to begin by congratulating today's award recipients. A special congratulations to Bobby Morris on your well-deserved Lionheart Award for fearless mental health advocacy. To our Legislator of the Year, Representative David Bennett, and Senator Lou Palmer. I'd like to note that Senator Palmer always reminds me that he's my favorite senator. I'd also like to congratulate our Mental Health Hero of the Year, Michelle Taylor, the Vice President of Social Health services at Community Care Alliance. The dedication and impact all of you have made over the past years, and for many years, have been extraordinary, and your awards are well deserved. Please accept my heartfelt congratulations. As Lori Marie said, with nearly 1 in 5 adults in the U.S. experiencing a mental illness each year, mental health is not something that happens to other people. Rather, it is a shared experience that touches every family, every workplace, every community. A few years ago, the theme of this event was, "We all know someone." Truer words have never been spoken. Yet despite that, stigma and fear continue to prevent many from seeking the help they need. Sadly, that silence has been devastating. As a community, we need to break that silence. We must foster open, honest conversations about mental health. Conversations that acknowledge the pain, the honor of courage, and promote healing. Those discussions are not easy, but they are essential. Every time we talk about mental health with empathy, understanding, we chip away at the stigma that keeps people isolated and in the shadows. Mental illness is treatable and recovery is possible. Conditions like depression, anxiety disorder, PTSD, bipolar, and schizophrenia are medical conditions, no different in their legitimacy than heart disease or diabetes. With the right support and treatment, individuals can and do lead full and meaningful lives. As the State Mental Health Authority, I know this work cannot be done in isolation. It takes all of us, advocates, care providers, educators, employers, faith leaders, and community leaders, to create systems of support that meet people where they are. Your voices, your lived experiences, and your ongoing involvement are essential to driving the systemic changes that we need through all branches of government and in all of our communities. Our department continues to expand access to care to new and innovative behavioral health programs. Programs such as certified community behavioral health clinics, the 988 suicide prevention and crisis line, and the ongoing work to create the Olmstead Plan have a meaningful impact. But progress is only possible with your continued partnership. So please continue to stand with us. Be part of the movement that makes mental health a priority, not a secret. Know that we stand with you today and every day in unwavering support for those living with mental health challenges. Together, we can build healthier, more compassionate communities for all. Thank you.
Hello, I'm Sandra Padrino. I'm the chair of the Mental Health Association of Rhode Island. It's good to see so many familiar faces and so many new ones. Thank you all so much for the work that you do. And today I have the honor of presenting our first award, which was created specifically to honor Barbara Morse. Barbara anchors NBC 10 News at noon and serves as a station health check reporter. She joined NBC in 1995, and since that time, she has used her role as a journalist to bring Rhode Islanders information about important health and human interest topics. She's covered stories ranging from Alzheimer's disease and cancer to child abuse and overdose prevention. Barbara has also highlighted mental health topics in many of her stories. She's been an advocate to expand access to mental health and behavioral health services in Rhode Island. In fact, over the past several years, Barbara has spoken at this annual event and publicly shared her family's story of mental illness. Her openness in sharing her experiences means so much to Rhode Islanders who are also struggling. Sharing our stories helps reduce stigma and fosters compassion and understanding. It inspires hope and empowers others to seek help and support. It takes true courage to share one's pain and lived experience in such a public way. Barbara has used her personal pain and stature in the community to help others, and this is truly an act of love and service. We are delighted to present the Lionheart Award for Fearless Mental Health Advocacy to Barbara Morris.
It's interesting, and I love the name of this, the Lionheart Award for Fearless Mental Health Advocacy. I did, of course, I don't write a speech because I just speak from the heart, so, I might mess up a little bit. But I only decided to share my story of my mom after my ex-husband and one of my best friends died from overdoses. One had bipolar, the other my ex-husband just had depression most of his life. So those are what compelled me to come forward. When my mom died, I was 16, my sister 15, and my brother 11. We didn't tell anyone how mom died. She died of a brain aneurysm. That sounded good. And then I realized I don't need to hide anymore. A lot of us are fearful that people will look at us differently. And say, well, your mom died from an overdose, so you probably will too. This is how I think a lot of people feel. And we are not other people. If you have a mental illness, there should be no stigma at all. Another thing that compels me to tell my story is my daughter, one of my daughters, who battles depression. Before 9/88, there was not a great system in place, and she was at Kent State University in Ohio, and she called the suicide prevention hotline and was put on hold. She called me. I flew her right home. She had just started her first semester, put her in the adult partial hospitalization at Rhode Island Hospital. Thank you, Jesus, that she was able to get in because that saved her life. And now she does telemedicine, when she's, feeling low, she'll call me. But, she is taking care of herself, and this is what this is all about. Sharing your story so others know they're not alone. They're not afraid to reach out, and they know that help is out there. So, in accepting this award, I accept it on behalf of everyone who has shared their story. I don't care if you share it to one person, because if you can save one life, that's great. So I applaud everyone who's thinking, maybe I should share my story. Maybe you should. Maybe you don't have to. But I really appreciate everyone in this room. I know if I ask you if you've been touched by mental illness, whether personally or a loved one, you'd all raise your hands, right? Most people have. So I appreciate this award. I'm sure it'll be one of many, and I'm sure maybe everyone in this room will eventually get it because they probably deserve it. So thank you so much. And I will continue to fearlessly advocate.
Good afternoon, everyone. My name is Amanda, and I am grateful to be here today. Thank you for allowing me to share a piece of my story with all of you. I grew up in state care from age 12 until I aged out. I bounced around from facility to facility, group homes, foster homes, kinships. The list goes on. I fell through the cracks of a broken system with no family in sight. Vicious cycles were formed, unhealthy patterns were created, and there was no mother-child reunification programs that was suitable for my needs and my children's needs. So I left the state of Rhode Island, and it was the toughest decision I ever made in my life. It was the heart-wrenching to sign my children over to a guardianship. I can honestly tell you today it saved my life. It really, truly did. I had to learn to stay clean a day at a time, learn to love myself again, gain healthy coping skills, and healthy relationships as well. And what I found is that there is no such thing as a geographical cure, because I brought self with me. I brought all that pain, all that fear, all that anger. I didn't know this at the time, but my rock bottom became my spiritual foundation. Once the pain of staying the same becomes greater than the pain of change, change will occur. The trials and tribulations, the stigma I face is challenging. However, I have learned to lean into my own autonomy. The ones that love me until I can love myself, the ones that encourage me to strive for a better tomorrow. Today, I am in a healthy, loving, communicated relationship with my better half, Oscar. From hiking to road trips, playing crib with pops. I couldn't imagine life without you. Thank you. Devin is 25. That's my oldest. He still calls my phone for either a recipe or $20 to borrow to do laundry. I love it. My daughter, Italia, she's 18, she's graduating from high school, and she's accepted to Rick. I love it, I'm so proud of her. She's my biggest fan. I'm her biggest fan too. But my two youngest patients, 16 and Hunter, 15, just recently came home after a very long, 13 hard-fought years. And yes, there are a lot of challenges with this. Primary care and housing is just the tip of the iceberg. They left as babies and came home as teenagers. Getting to know them is nothing short of a miracle. I'm alive to witness every milestone in their life. Hunter is musically inclined. He could pick up any instrument and find a love for it. He too is on waiting list for mental health stuff through DCYF, so that's we're struggling in that area right now as well. Patience is highly intelligent with a set of pipes on her. Some nights I stop to listen to hear her sing and I can't help but to be in awe. She's getting her driver's license next week. Let's just go and stay in awe. Well, kidding aside, I truly am blessed to be able to teach them how to drive, fill out a job application, shop for prom dresses, track meets and band concerts, to check out different colleges, or to listen to teenage heartbreak. I have amazing support from the Parent Support Network, a 12-step fellowship, and friends that I now call family. Today I have a full-time job, and I sit on the Children's Behavioral Health Board, Parent Advisory Board for DCYF, and the Children's Wellness Advisory Committee. Giving back to the community is essential not only for my recovery, but for my mental health as well. It feels good to give back to what was so freely given to me, and I hope to inspire anyone that is struggling to let them know it's okay to not be okay. Nothing grows without water, and don't give up before the miracle happens. Thank you.
Hello everyone, my name is Inez, and I do live with mental health and substance abuse disorder and recovery. You were to ask me what was helpful to me in this journey. When I got here, it was via suicide. I tried several times. And my last time I was gonna be successful, very successful. And something told me to call somebody. The thing is, I didn't have nobody to call. And the people that I was around, they didn't know nothing about mental health. Neither did I at the time. So I went to Yellow Pages, for those who don't know, those are the people. And there was a suicide hotline. Thank God for 988, because that makes it easier now. We don't have to go looking for numbers. And I called, and that was in 2005. And that's how my journey began. So I was suicide. Let me add this. My last attempt, when I went to the hospital, stigma is a big problem, even in the hospitals. I was pumped, my stomach was pumped and then sent home. No one gave me support, no one gave me a social worker or referrals to like the mental health care. No, they just sent me home. If you ask me, what is the biggest challenge in this for living with mental health? It's getting the right help. That's the biggest challenge. I'm Latina. I don't have Latino peer therapists. And I've been going to therapy for almost 30 years, and I'm yet to see a Spanish or Latino therapist that I can identify with. So that is a barrier for me. Because when I first started this process, my English wasn't that great. But I had to settle for whatever I was given. Another challenge is the day-to-day. I have major depressive disorder, PTSD complex, conversion disorder, all that fun stuff. So I have pretty serious conditions, but I'm not ashamed of it no more. Well, don't like me the way I am too bad. Everybody has something. I just happen to have mental illness. If I was to inspire anybody, this is what I would say. Nothing beats a failure but a try. If you're trying, you're not failing. As long as you're trying, you're good to go. Thanks. Access to services saves lives and is made possible by the dedicated leaders in this state house. Right now, we will honor one of those leaders. Chairman Luke Palma has demonstrated an unwavering commitment to the well-being and rights of some of the most vulnerable members of our community. He has advocated for children in the care of state, older adults in nursing homes, people with disabilities, and those with mental illness and substance disorders. He has been the voice for so many Rhinelanders who cannot speak for themselves. Chairman DePalma has been a bold and tenacious driving force behind Rhode Island's first Homestead Plan, which ensures that people with disabilities have the opportunity to live, learn, work, and participate in the most integrated setting appropriate to their needs. He doesn't just talk the talk, he takes action. Senator DePalma regularly attends state and community meetings, where he has been an outspoken champion for forces that truly affect the lives of Rhinelanders. As chair of the Senate Finance Committee, Chairman DePalma has helped secure funding to strengthen our state's continuum of care, including the establishment of certified community behavioral clinics and renovations to Eleanor Slater Hospital. He initiated a feasibility study to examine the cost and logistics associated with suicide prevention nets on bridges, and he has advocated for state-filled funding for the 988 suicide prevention crisis line and behavioral health training in schools. Chairman DePalma successfully sponsored and passed the bills requiring all recovery housing facilities to register with the Department of Behavioral Health Care, Developmental Disabilities, and Hospitals, and adhere to the National Alliance for Recovery Resiliences process. He successfully spearheaded a bill to create the Rhode Island Data Transparency and Privacy which ensures data privacy protection for Rhode Islanders' personal data. In short, Chairman De Palma has dedicated his time in the Senate House to genuinely serve the people of Rhode Island, exemplifying what it means to be a true do-gooder. Today, we are excited to present Chair De Palma with this Legislator of the Year Award.
Thank you very much for the recognition for it. Thank you for all you do. Several senators were here. Senate President Valerie Austin, our Majority Leader Frank Chacon, our Minority Leader Jessica Dela Cruz, Senator Urso, and our Majority Whip, Senator DeCoin. Did I miss anybody? Senator Urso, I did that. I guess they're coming in. Senator, thank you all for being here. While I'm getting this award, it's really, and I'm looking out to the audience, I don't just say this particularly, it's you folks that are doing that work. You folks that when that 988 phone rings, are answering that call and giving the service to those folks who need the service. Hearing the stories, and we could all be there. We could all be there tomorrow. We all know our family members who have been there, still there, or might be there tomorrow. You folks have been doing this work. You folks have been doing this for decades. I recognize a lot of faces out there who clearly want to bend lesson. At Community Care Alliance. We've had some spirited conversations over my 17 years in the Senate. By the way, all the things you talk about, I did all last year. No. And by the way, none of us do any of these on our own. None of us do any of these on our own. When I got elected to the Senate, I made one commitment. And I think you heard it when I will end this with a quote. I will speak very briefly. I want to be the eyes, the ears, the mouth. I'll probably say that wrong, but I'm saying that way. For those folks who don't come to the State House. Not don't come, but can't come to the State House. Or find it very difficult to come to the State House. For a variety of reasons. Those are seniors and nursing homes. We don't see many in the State House because they're confined to nursing homes. Children in the care of child welfare, DCYF. I don't want to say care of the state, but are receiving services. They're not showing up to the State House. Their parents sometimes are. Those with mental health. Those with intellectual and developmental disabilities. They're not coming to the State House on a very regular basis. We have 38 senators, we have 75 reps. We need to read their eyes, their ears, and their mouth to make certain the message is across. What I've tried to do over my 17 years, as we enact and think about whatever policy we're talking about, and forget about the committee. So I served on finance for 17 years, and I served on education for 17 years. Short stint on the other side a couple times. At the end of the day, the policies we enact and the decisions we make need to be made for all the members. We know about the folks who come here, and they have great representation by you folks. We typically don't see them. And that's not a knock against them. It's not against us. We need to ensure that they're visible, quote unquote, in our conversations, in our deliberations. If we talk about Olmsted, and I try and participate in the Olmsted meeting that Lori has on a regular basis, along with others, and the Olmsted plan, we've had some very challenging discussions with the administration. I'm always going to be respectfully direct. That's all I know. I'm a facts, data, and context person. I'm an engineer. That's what I do every day. It's about getting stuff done. The issue with regards to waiting lists, which is unconscionable. We've had these conversations. It needs to go away. Someone said we don't have services. Guess what? Don't care. The Olmsted Act ensures you get the services at the right time in the right setting. So I mentioned before, with regards to not having a place in this place or that place, it's unacceptable. It just is. That means we all need to work together to make that happen.
And one way we did work together, and it was a sort of a conscious decision we made several years ago, when we did the comprehensive rate review legislation that ultimately made it into the budget. I want to thank Representative Julie Cadmero. We worked hand in hand on that for a long period of time to make that happen. It happened because of you folks out there and others that said we need to do this. I had two bills in it. Representative Cadmero had the same two on her side. One was looking at health and human service rates, another one looking at healthcare rates. We know where we are with that. That needs to be addressed. We made a conscious effort back then. We need to look at the health and human service side of things. On the Senate side, as I said, there's 38 senators. All 38 signed both bills. All 38 signed them. So while I'm here, and I want to congratulate and glad to be here with Chairman Bennett, it's really, I'm representing the other 38 senators, and we'll speak for Chairman Bennett, we'll speak for himself, but we speak for all of our colleagues, and that's how we got stuff done. And it was a big deal to fund those rates last year. Big deal to fund those rates. The request was to fund them at the full amount. Agency to the state governor, break it in two. The governor to the General Assembly, break it in three. Came back later on an amendment, break it in four. You ain't doing that. Guess what? We did the whole thing. We did the whole thing. We now need to take that next step with regards to healthcare. That's a topic for another day. Lori, thank you for your work. Thank you for your work. I want to end on this note. And when we put forward that legislation several years ago, I went to all the public and private unions out there that I could remember, and I knew. It was like 16 or 17 of them. And they cared about it. And I got their signatures on a memo that got sent to Senate President Ruggiero and Speaker Sakarsky. It ended with this. We're reminded of a quote by Vice President Hubert. Some of us will remember him, some of us will remember him. And other may not. The moral test of government is how that government treats those who are on the dawn of life, the children, those who are in the twilight of life, the elderly, and those who are in the shadows of life, the sick, the needy, and the handicapped. We need to make sure that we're their voice to all of that. And guess what? At the end of the day, I'm hoping I'm tested based on how I address it. Thank you very much.
Good afternoon. My name is Sabrina Calvert. Thank you for taking the time to be here today and for letting me share my story. Looking back on my earliest memories, I cannot recall a time when I wasn't struggling. I was labeled a badly behaving child when in fact I was a child who was suffering mentally. By the time I was a teenager and young adult, I was suffering from major depression and anxiety, insomnia, an eating disorder, and PTSD. I was alone and felt very lonely. I started working when I was 13, moved out on my own before my senior year in high school. Self-sufficiency felt safer than meeting people. With the help of a new doctor and later the university psychiatrist, I felt heard, believed, and supported in my mental health journey for the first time ever. I even began making friends. Back surgery sidelined me after my freshman year in college. For many years, it was a daily fight for my mental and physical health. One day, while moving into my new house, I had a terrible fall. I was left home and bedbound and on a high dose of narcotics. Access to telehealth or any type of in-home medical care for both mental and physical health did not exist back then. I fell into a deep depression, became agoraphobic, and lost the next 17 years of my life. Something inside me finally said enough is enough. I found a pain doctor who weaned me off of the Not knowing the community or the resources made it impossible to find the proper aftercare that I needed. After a lot of time, stress, and 2 changes to my insurance, I finally found the amazing therapist that I am still seeing to this day. When you go for outpatient surgery, they call you the next day and ask you how you're doing. When you leave a behavioral health facility, nobody calls you. I wanted to change this, so I trained to become a certified peer recovery specialist. I've been interning most recently with Horizon Healthcare Partners, and now volunteer my time as the first peer specialist to work in the behavioral health department at Women and Infants. I have found joy and purpose in this work. I want to prevent others from feeling as lost and alone as I did after leaving those 2 hospital programs. I am in the best place mentally that I have ever been. I also accept that I'm still on a very long journey. Recovery is ongoing and a lifelong process. We cannot be healthy without mental health. It is okay to not be okay. Help is out there, and there is no shame in asking for it. I now consider Rhode Island my home, and I'm so proud of all the dedicated people who fight every day for our rights. From the bottom of my heart, I am sending out love and compassion to anyone who needs it. Please embrace it, take it in, and know that you are not alone and deserve it. Thank you. Champion, a leader who has demonstrated an unwavering commitment to the well-being and rights of some of the most vulnerable members of our community. Today we celebrate Chairman David Bennett for his outstanding work in advocating for access to behavioral health services. His dedication has been instrumental in driving positive change and fostering a more inclusive and equitable society. As a psychiatric nurse, Representative Bennett understands that access to quality behavioral health services is not a privilege, but a need and a fundamental right. He has successfully sponsored and helped pass several legislative bills to strengthen Rhode Island's system of behavioral health care, expand its workforce, and increase access to prescription medications. Representative Bennett successfully spearheaded legislation to require all middle schools and high schools to have Narcan on hand in order to prevent overdose deaths. He sponsored and helped pass legislation to make opioid antagonists like Narcan more readily available and ensure follow-up care for overdose patients. Chairman Bennett bravely and publicly shared his effort to quit smoking, which has helped end stigma and inspires others to take the first steps in their own journey. He passionately advocated for the establishment of an Olmstead plan for Rhode Islanders with disabilities. Soon, Rhode Island will have its first Olmstead plan, and this is nothing short of amazing. Representative Bennett currently chairs the House Environment and Natural Resources Committee. He has been a passionate advocate for the environment, animals, older adults, and those with disabilities or substance use disorders. Today, we are thrilled to present Chairman Bennett with this Legislature of the Year award. This award is a token of our gratitude for his exceptional leadership, unwavering advocacy, and profound impact on the lives of so many. Please join me in congratulating Chairman Bennett on this well-deserved honor.
It's an honor to be recognized by my friends in Mental Health Association of Rhode Island. I'm thankful for their partnership and their hard work and all the many advocates, mental health professionals, volunteers, whose efforts each day provide safety, dignity, and support for Rhode Islanders. In particular, Senator Lou DePalma and I have, for a number of years, brought legislation to establish an Olmstead plan, a statewide strategy to ensure
that those with disabilities receive services and care in the most integrated setting possible to avoid institutionalizing and votes unnecessary. This year, we're not introducing this bill because last August, Governor McKee signed an executive order to create the onset plan, and HHS released a draft plan in February. The plan will keep individuals in their communities when giving assistance and keeps scarce inpatient beds open for those who need them. It's been made possible by your tireless work. Chairman DePalmer, I have been fortunate to walk alongside on this journey to ensure that Islanders take the responsibility to care for our disabled residents with dignity. It's always important when you work with psychiatric people with disabilities, that you listen. I'm not a very good speaker. I listen. I've been doing it since I was 17 years old. I got into mental health. That was just a couple of years ago. Try to remember that the most important person in the world is the person sitting right in front of you, telling you their fears, their thoughts, and their hopes. They're the most important person in the world at that time. Thank you very much. I'm sorry, I didn't recognize my colleagues. Okay, that is Chairwoman Susan Gardner from Health and Human Services. Dr. June Speak, who's one of our chairwomen. And I've got a representative that came in with me in 2010, 2011. We're still here, Teresa Dancy. Thank you very much. George Senior for all his work on mental health parity, and Bob Marshall for making the homestead plan, waiting for me every January I walk in the door. Thank you.
Forgive me, I'm not used to this. Good afternoon, everybody. It's my honor and privilege to be here. Thank you, Lauren Marie, the Mental Health Association of Rhode Island, for all your hard work. I did not know what to talk about this, and thank you for allowing me to share my story today. It means a lot. My name is Christian Nunez, and I am the proud son of Laura Escobar and Wilfredo Nunez Sr., two individuals that, despite leaving their home islands of Puerto Rico y la República Dominicana, created a family here in Rhode Island. I grew up to Spanish music on Saturdays. Not my favorite thing, but it is now. And my father's epic retelling of Bible stories. However, there's another story, and that's what happened kind of behind closed doors. The inner works, I would say. I faced many silent battles growing up. Tears of pain rolled down my face as I covered my ears from the never-ending arguments and screaming between the two individuals that I looked up to the most. Amazing parents, just struggled. As they battled externally, I battled internally as a child, questioning how two people that I loved so much could love each other. In 2016, several years later, following the passing of my grandma and two of my high school friends, I went into a bit of a spiral. I lashed out on those close to me, I dissociated with substances, and I found myself in an old place, a dark place, One I say that was far away from the world, family, and God. It was not until a friend recommended the campus mental health office and several attempts, several unanswered emails that I would ignore, that I began speaking with an incredible mental health hero, an incredible therapist. It was then that I began to see a bit of the light. I began stitching together my anger, sadness, and fears of abandonment to the internal battles I faced as a child. I remembered certain things that I thought were long erased, things I now know are trauma. Although this revelation allowed me to regain control of my life and pushed me to graduate from college, being the first one in my family, I would still be faced with challenges once I returned home. I purposely stayed away for several years, and they purposely didn't tell me a lot of information while I was away. In 2019, I returned to my parents separated, with each of them on their own journey. My father, although as strong as always, battled the fight I could only identify because it was like my own. It was a fight with trauma. However, he struggled to see that at first, and as we lived together from 2019 to 2022, there were many silent mornings in which I would catch him looking into an empty black TV screen. Despite it all, through laughter, arguments, and tears, through prayer, and by retelling of the same stories he told me long ago, we began connecting and revealing aspects of his past that overlapped with my own. We became best friends. And in 2022, my father opened up to many others at his church, his friends, or family members about his childhood trauma. He told me he was addicted to heroin for 13 years in Puerto Rico, and what led him to often fighting instead of communicating his fears and pain. He had a tattoo on his neck of a lion, and he got that in one of his darkest moments because he needed a symbol of hope, of fierceness. Sadly, in 2023, my father passed away, and his passing is what brought me to my current role of being a family support partner with the Parent Support Network of Rhode Island. Each day, I have the honor and the privilege to share my lived experiences with others from the perspective of the child and the son that witnessed the father redeem himself. On his grave that I visit when I have the strength, it reads, "He has fought the good fight, he has finished the race, and has maintained his faith." My call to you who are listening, to you who are facing a silent battle, or in a position of support, a position of power like a legislator, I am one of many, and I call you today to fight the good fight, to support each other in finishing the race, and throughout it all, to maintain your faith. And now, with the atmosphere, to my lovely fiance, who's been there every step of the way. But now I want to turn the energy a little bit. I hope you're all pumped. You're all willing to fight the good fight, because it's worth it. With the atmosphere we've built, it's time to present our final award, one that I take personal, our Mental Health Hero of the Year. This year, we are honoring Michelle Taylor for her compassionate and tireless advocacy for vulnerable Rhode Islanders. Michelle has dedicated almost 3 decades to serving individuals whose lives have been negatively impacted by the social determinants of health, especially unhoused Rhode Islanders with mental illness. As the Vice President of the Social Health Services Division at the Community Care Alliance, Michelle leads by example and with the utmost compassion for all people. She She is known to work an all-nighter at pop-up shelters or take an on-call 24-hour shift when no one else will do it. Michelle believes in the sanctity of every person and the right to lead a healthy and meaningful life. This is her guiding principle. She shows it in every compassionate gesture, but also by fiercely advocating on many different levels. From seeking out basic needs for clients to standing up for people with no voice at the State Department level. Michelle's devoted to understanding the systemic biases built in the very foundation of our society and to combating inequities. She does this with intent and an emphasis on implementing evidence-based practices aimed at ensuring that our efforts are driven not only by good intentions, but that we are optimally effective in supporting others on their personal journey. Her clinical expertise has grown out of a career that encompasses many areas. She's been a teacher, an evaluator, a counselor, a therapist, a grant and policy writer, a program director, and an entrepreneur. Everyone will tell you no one can match Michelle's energy and ability to get a million things done. Luckily for Rhode Islanders, Michelle directs this energy to the improvement of people's lives like my own. Michelle will humbly tell you that all the honor should go to her team, those working with the boots on the ground, but her colleagues fiercely support her recognition with deep admiration, praise, and respect as they follow her lead. Please join me in congratulating Michelle Taylor, our Mental Health Hero of the Year.
So I just want to point out, yes, I've been working for almost 3 decades, but I did start working when I was 2. They whispered to her, "You cannot withstand the storm." She whispered back, "I am the storm. Indeed I am." I grew up in a household with a father whose storm was internal. He struggled with bipolar disorder and often managed those symptoms with the use of alcohol. There were times when our mother locked us in our bedroom because she thought our father would shoot us during the night and then turn the gun on himself. These are some of the worst memories that I have of my childhood. Mental illness often robs us of a feeling of safety. I want to thank Mahari for this tremendous honor, and yes, I do accept it on behalf of my staff, my coworkers, leadership, and community partners, including the leadership in the city of Woonsocket. I want to talk about one of the most detrimental aspects of mental health, one of the things that is most corrosive to our mental health, and that is chronic homelessness. It is a solvable problem. The primary cause is the lack of affordable and supported housing. Those with certain characteristics are more likely to be impacted. Certainly people with mental health issues, people struggling with addiction, BIPOC, LGBTQ+, those who are elderly, people facing financial insecurity, or physical health issues. These are not causal of correlations. This is because individuals with these challenges often lack protective factors to avoid or prevent homelessness, especially when housing inventory is so low. In Rhode Island, the housing wage for a 2-bedroom apartment at fair market rent is $33.20 per hour. This means an individual needs to earn at least this hourly rate to afford a 2-bedroom apartment without being considered cost burden, which is defined as spending more than 30% of the gross income on housing. Somehow, the richest country in the world has chosen to turn its back on the homeless by blaming the victims. If we look at homelessness as a choice or a consequence of bad decisions or poor character, we can sleep at night. But in truth, homelessness is the failure of many systems: housing, behavioral health, education, and perhaps most important, our tolerance of greed that allows some individuals to amass huge fortunes at the expense of others. Chronic homelessness is fatal. People who are homeless are 60% more likely to die from their peers, or than their peers, from preventable health issues, including mental health issues and addiction. Housing is health care. It is behavioral health care. It saves lives and is a basic human right. We should ask ourselves how we have allowed ourselves to become so callous to the suffering of others. People complain about encampments as a nuisance, not because they are concerned that we have abandoned members of our community and because they are dying. They complain about trash and people going to the bathroom outdoors without any concern for why this is happening. it is because we have turned our backs on the most vulnerable members of our community. Diversity, equity, and inclusion are the pillars of a fair and just society. Isabel Wilkerson has made a compelling case that the United States has developed its own caste system that began with the Constitution that legalized slavery. We have been encoding inequity in our laws ever since. Rather than villainize people for falling into the trap set for them, we need to work together to raise them up. We need to rise up against policies and procedures that have created these crises. We have the power, and we need to use it on behalf of those who don't. These are our family, our friends, and neighbors, and they need us now more than ever. Thank you again to Mahari and to all of those already united in this fight, and to my friends and family for their support. I won't rest until every Rhode Island citizen has a roof over their head. I hope you'll join me.
Congratulations again to Chairman DePalma, Chairman Bennett, Michelle Taylor, and Barbara Morse. We thank you for your service, and you make Rhode Island a great place to live. You make a difference in Rhode Islanders' lives every day. Thank you for all you do. I also want to thank our brave, courageous, phenomenal speakers who spoke today. It's not easy. We cultivate compassion and understanding, and we reduce stigma and prejudice. And I'm so grateful for the four of you speaking today. You did a phenomenal job, and I'm very, very grateful. And I just want to give you another round of applause. Some of you may already know this, but I love telling the story, so here goes. So the founder of our national organization, which is called Mental Health America, based in Virginia, is a guy named Clifford Beers. And Mr. Beers went to Yale, and he was a Wall Street banker, and he lost at least 2 of his siblings to suicide. He also lived with mental illness, and he spent a considerable amount of his adult life living in what used to be called asylums. And back then, asylums were dehumanizing. They were horrific. They were filthy and overcrowded. Patients could be caged. Patients could be shackled in place. When he was released back into the community, rebuilding his life, he wrote an autobiography called A Mind That Found Itself. And it chronicled his time living in these asylums. And physicians across the United States read his autobiography and were moved. And together they ignited a wave of behavioral health care reforms, many of which are still in place today. So after he became this national figure, some of the folks he was working with advised him not to talk about his mental illness. Don't tell people what you've been through. Don't talk about your diagnoses. Don't talk about being in an asylum. And he said, no thanks, I must fight in the open. And so that is our motto, fight in the open. And today you all have an opportunity to fight in the open. There is a public hearing this afternoon after 4 o'clock. It's a bill that would create a sustainable funding force for 988. Please drop by the Senate Finance Committee located in room 211 today and sign up in support of bill number 892. And if you can, please stay and testify in favor of it and tell our leaders how important 988 is to folks in Rhode Island. Also, I'm asking everyone in this room to pop over want to thank our friends at the Bristol Health Equity Zone for the beautiful banner they've placed in the back. They are holding a Ribbons for Remembrance ceremony on May 9th at 5 o'clock. And all are welcome to attend and support suicide prevention or to honor the memory of a loved one who was lost to suicide. And again, that's the Bristol Health Equity Zone. I want to Our friends at NAMI Rhode Island are holding their annual Bridging the Gaps conference. It's on May 29th. If you go to NAMI Rhode Island's website, you'll learn more information about who the presenters are. And I'm sure Beth would be happy to answer any questions. I also want to take this opportunity to invite everyone to Mahari's first walkathon. It's on the last Saturday in May at Roger Williams Park. We have flyers on our table if you want to stop by and grab a flyer. You can register online or using this QR code. We appreciate your support. More details can be found on our website as well. I want to thank our very generous sponsors for making today possible. Thank you for supporting the Mental Health Association and the behavioral health community. Our gold sponsors are Care New England, Butler Hospital, Providence Center, Blue Cross Blue Shield of Rhode Island, the Brown University School of Public Health, and Radley Hospital. Silver sponsors are 988 Horizon Healthcare Partners, and bronze sponsors are Newport Mental Health, Tides Family Services, Kodak Behavioral Health Care, Community Care Alliance, Thrive Behavioral Health, American Foundation for Suicide Prevention, Neighborhood Health Plan of Rhode Island, the Parent Support Network of Rhode Island, and Coastal One Credit Union. Thank you so much for your generosity and for supporting us. I also want to give a shout out to the Mental Health Association's Board of Directors. You're phenomenal. You keep this organization going, and I appreciate all of the love and support you give me every day. I'm super lucky. Also want to thank the hardworking staff of the Mental Health Association, Michelle Miller, Terrence Charles, and Laura Shank, who made this event possible. Thank you all. Lastly, thank all of you for showing up today and for caring about Rhode Islanders who live with mental illness, including substance use disorders. I hope to see you again here in a year. Thank you so much.